first question is, please tell us how you got interested in mental health and the way that Rose Health started.
Sure. So I started Rose about 4 years ago, really based on two realizations I had. One was more on the business side, and the other was more on the personal side. On the business side, my background is in healthcare investment. So I was a healthcare M&A investment banker for JP Morgan and SunTrust. And then I transitioned over to the payer side where I work more. I joined Northwell Health, which is New York's largest health system, and was part of the New Ventures and Strategic Group, and worked on them on building out Northwell's first narrow network health insurance company called Care Connect. And it was at that point where I learned the importance of digital therapeutics and digital tools for chronic conditions like oncology, heart disease, and diabetes, and saw how important those tools were for lowering costs as well as improving outcomes. But then saw that there were little to no tools available for mental health. And that really showed in our monthly meetings where we would see that the cost of mental health would increase about almost 20% month over month due to pure decompensation of our patients, and then also due to leakage, which is the last thing that you would want at a narrow network health insurance company. So saw the opportunity there to be able to have a tool that can help with mental health, a digital therapeutic essentially. But what really formed Rose is more on the personal side. After working 80 to 100-hour work weeks for about 10 years, I finally burned out, and I fell into my own depression when I burned out, and was actually bedridden with depression for about a month. And it was during that time I learned very quickly that depression is not a passive state. It may seem that way to people on the outside, but to the person going through it, it's just an active state of pain that really takes over your entire body, literally from the top of your head all the way to the bottom of your feet, right? And I finally had the wherewithal and the support to seek care and experience mental health care for the first time, and was just blown away by the inefficiencies of not just accessing care, but purely navigating the mental health care ecosystem as a whole. And just saw my friends and colleagues going through the same concerns, and decided to do something about it and leverage my experience as an investor, as an entrepreneur, but most importantly as a patient actually, to build Rose into what it is today. And Rose is an acronym for recognition of speech and emotion. So what we do is we leverage deep tech and deep science for early detection of depression and mood disorders. And we do so by collecting data about the patient so that we are able to leverage AI algorithms. So we have 7 different AI algorithms that allow us to treat the patient from early detection all the way to sustained remission, so that we can be in a position where we're able to provide the entire continuum of mental health care to that person, especially in this vulnerable state that that patient is in, where we can now take the burden of care away from that patient and help them through the process.
I know you just touched on this with the AI algorithms, but how exactly does Rose Health use technology in order to detect depression and mood disorders earlier? And how is this early detection more of a benefit for a patient's health?
Yeah, sure. So I'll take the second question first. So how it's more beneficial for patients' health is just that when you look at the numbers and you look at the cost of care from someone that has just pure stress versus anxiety, depression, self-harm, suicide, you'll notice that it impacts significantly not just the financials of how much it costs to take care from one segment to the other, but the toll that it has on that patient as well as that patient's family. So being able to detect depression earlier is significant in for a number of reasons, going all the way from financial to even societal benefits, right? Because it has been shown that those who are more at risk of a mental health, the cost of care is significantly higher. And then if you want to take a look at it on like a societal aspect of it, you could see that those with a mental those who are higher on a mental health risk, they're more likely to commit a crime or something along those lines that you
Hmm.
typically would see. So definitely the earlier detection helps in being able to nip it in the bud so that that person gets the care they need. And at Rose, we do aim to provide the right level of care to the right person at the right time so that we can make sure that that patient gets the care before it escalates. And then when you
Hmm.
even talk about what it looks like financially, the cost it costs about 8 to 10 times more for a person that has just a regular, not regular, but more so has um, a, a depressive or mood disorder at a mild to moderate level. It costs about 10 times more if and that ends up turning into a serious mental health disorder. So the
Hmm.
financials as well is impacted. Um, your first question on how Rose leverages AI, we leverage the data that's collected on the person. So, for example,
Hmm.
we look at data from the EHR or we look at claims data on the patient, and that that can be things like looking into the EHR for ICD-10 codes or at potential comorbidities that the patient may have been diagnosed with, whether that's something related to um, recently diagnosed with oncology or with cancer rather, or just had a heart attack or
Hmm.
um, even something so as like grief, right? And that makes a person more apt to have a mental health concern. So that person is someone, or even fluctuation in weight, since the fluctuation in weight is one of the largest or one of the most well-known symptoms of a serious mental health concern.
Hmm.
And based on that, we would then risk stratify the patient into buckets of green, yellow, red, and then we would identify the patients who would need help. And then once we identify them, that's when we would end up bringing them onto the platform, inviting them to the platform. And once they're on the platform, we have 6 other AI algorithms that really work to help them in a seamless way, in a frictionless way, rather, so that they're able to get to the right place at the right time, given the right tools at the right time, given the right care at the right time, so that they're able to move along through the continuum of care. That's whether they need access to just our Rose platform. And in the Rose platform, there are multiple AI algorithms in there. One is an algorithm where the patient would enter in their journal entry. So we ask them to journal on a daily basis, and then we run a natural language processing algorithm on that journal entry. And with a 95% accuracy rate, we can detect semantic tones. So we know what that patient is dealing with: anxiety, depression, relationship issues, health issues, financial issues. And based on that, we'll risk stratify them, like I mentioned, into buckets of green, yellow, red, which really stand for mild, moderate, severe. And from that point on, we also have a recommendation algorithm that allows us to curate content for self-care. So whether you're in the green, yellow, or red, or whatever you're dealing with relationship issues or health issues or financial issues, our algorithm will push curated content for self-care. And we have
Hmm.
over 1,000 pieces of content in the form of articles, audio recordings, and videos, all aimed at building mental health resiliency and building coping mechanisms. Additionally, one of the more important algorithms we have is called our fire flag algorithm, which with a 95% F1 accuracy score, we can actually detect suicidal ideation. And that is a significant algorithm for us in being able to identify patients who may be at risk. And that's critical for us because we don't work with those that have a serious mental health indication, just given the fact that an app is not the best medium for someone
Hmm.
who's suicidal. So therefore, that is a really great safety net to be able to see when a person of mild to moderate depression or mood disorder ends up turning into a suicidal ideation case.
Hmm. Yeah. My next question is, I know that Rose Health relies on telemedicine, and I was wondering if you believe that meetings with mental health professionals online is just as effective as in person.
So I think that it isn't as effective as meeting in person. However, just given the shortages and the skewed supply and demand, that's a ratio that's out there. I think
Hmm.
it's as long as a person is able to get some sort of help, whether in person or online, it really is better and beneficial for that patient. I think online you don't really see the full aspect, or you're not. This is more, I would say, for the clinician. They're not able to gauge um, what body signs or body signals of when a patient speaks, and also um, you can also argue on the other side that it actually is better because it makes things more efficient because you're
Hmm.
able to just hop on to your appointment like we are right now, meeting, and you can quickly get your 45-minute session done. Whereas if this was a in person, we'd have to drive 45 minutes, then the appointment, and drive back 45 minutes. So an appointment that really takes an hour ends up becoming almost 3 hours, and that is a big burden for folks who don't have the liberty of
Hmm.
being able to take that time off, especially when it's during working.
Yeah. Do you believe that there is like a barrier to monitoring patients between mental health treatment visits, or like the journaling on the app helps account for that?
Yeah, so the journaling and the entire suite of solutions that we have on the Rose platform accounts for that because we are able to uh, monitor these patients and see how they're doing in between sessions, whether they're improving in care or they're regressing in care. It still is it's one of the things we learned from the pandemic was how important it was to be aware of your patient or know where your patients are because it's a very scary thing when you think about it that during the pandemic when hospitals were closed due to COVID, um, a lot of clinicians just had no idea where their serious mental health related patients were, and that's very scary to know that a person with a
Hmm.
significant mental health issue is just out there somewhere. So I think being able to have access to them to see how they're doing in between sessions in the way that Rose does allows us to be in a position where we can identify the patients and then we can also provide feedback in between sessions as well. So that's where the importance of having a a monitoring team, which is what we have at Rose. Monitoring team allows us to detect patients who may be going down a path that they shouldn't, or a path of regression, and that allows us to step in and either give them the support they need or get them the support that through our Rose certified care team.
Hmm. Yeah. And I know you also just touched on this with the growing psychiatrist and psychologist shortage. Do you believe that the healthcare system will become more dependent on telemedicine and apps such as Rose Health as a result of this? And do you think this will cause patients to have a harder time finding the right mental health care for them?
Yeah, so I think that it definitely, which we have seen through the pandemic, that telemedicine has really grown significantly and finally got the attention it needed. Um, and that
Hmm.
was a big silver lining during the pandemic, or with the pandemic rather. And as we continue, we'll see that these appointments, especially appointments like therapy or those that where it's really more talk than having a physical touch, where like chiropractor, for example, or PT even,
Hmm.
that appointments can really be done through telemedicine, and it uh, and then I think what was the other question? The other few questions.
Do you think the shortage will cause patients to have a harder time finding the right mental health care for them?
Yeah, so the shortage definitely will make it difficult for patients to find a suitable fit. Um, Currently, the stats show that uh, there we're currently in need of about 225,000 therapists in order to meet the current demand. of those who need help, just given that the amount of folks who need help versus the amount of those that can provide help is highly skewed. So it will continue to be difficult for patients to um, uh, find a clinician, especially when you look at a lot of these clinicians don't take insurance. So it becomes such a
Mhm,
burden for someone who can't afford that specific clinician.
mhm. And how do you believe the cost of mental health care treatment affects access to care? I know you just mentioned insurance, and what do you think can be done to try to overcome this barrier?
Yeah, so that's a great question. I feel like if I knew the answer to that, then that would be that would be absolutely golden. I, I think the way things are set up is unfortunately that those that it's unfortunate that therapy is really a luxury, in my opinion, and only
Mhm,
those who have insurance or have the wherewithal to seek care can get that insurance. So the way that I would, the way that things could change and shape for the better is through care coordination, being able to whether you whether it's through your health plan or whether it's through Medicare, Medicaid, or even the health system, being able to have a sufficient care coordination program that can actually help the patient navigate through the different barriers and different hurdles so that they can get the care that they need and the help they need. Because when I burned out and I was bedridden with depression, the last thing I wanted to do was get up and do something. So I wasn't
mhm,
enterprising enough to be able, I didn't have the functionality to be able to get up and seek care, or even if an appointment was set up for me, I just would no show. And that's where that's where it kind of spirals out of control there because when you have a no show, you now are responsible for paying for that appointment. Insurance will not cover
mhm,
that. You just wasted an hour of your therapist's time where that hour could have been filled by someone else who needed the help. And that kind of now ruins the relationship. So it really ends up being a downfall by not being able um, to to the right get the right care at the right time. And
mhm,
also it's really difficult to find the right clinician, um, the right clinician or the right therapist, just given that therapy and having a therapist it requires such a close personal fit, unlike any other specialist like a psychiatrist, like a even a psychiatrist, but more so like a cardiologist or oncologist
mhm,
or something of the like. The therapist is someone that you really need to understand and really need to identify with that person. Because after all, they are someone that you see frequently, and also they are the ones that are giving you advice, and you definitely do want to speak with someone that you have a connection with, and also have a certain um, I guess, similarity in as far as cultural norms and things like that. That's why a lot of brown folks would rather see a brown therapist, just given the fact that they understand the culture, they understand why things may be this way, understand how uh, mental health may be stigmatized within the brown community, things of those things.
yeah, definitely. How do you believe the healthcare system should change in order to better address mental health issues with better diagnosis and treatment?
Yeah, that's also another fully loaded question. I, I think there's a lot that's currently being done. Um, and has been done to really improve mental health. But one of the biggest things we're seeing right now is that there are children, so folks between the age of 13 and 18, so child and adolescents, who are appearing in the emergency room for help and for a mental health concern. And that in itself is something that the system was really never prepared for. It was never prepared for a 13-year-old to go into the ER for suicidal ideation. And unfortunately, what we're seeing is that these hospitals have these, not just these child and adolescents, but also um, adults who are experiencing a mental health concern waiting for 5, 6 days in the ER for some sort of help. And I think what is needed is a way to decompress that patient as they come into the ER. And once they're in
Hmm.
the ER, get decompressed, we can quickly identify whether they need to be admitted or whether they need to be sent home. And if they need to be sent home, they get sent home with a proper tool like Rose that allows them to be fully monitored as well as have support, so that there isn't a readmission, and nor is there any sort of decompensation that happens once they're sent home.
Hmm. Yes. And I know you touched on this a little bit earlier, but how do you believe that cultural sensitivity impacts mental health care?
Yeah, I think it's significant. Cultural context is critical in finding a therapist, right? Because being able to have the same views can really affect whether it's a good relationship or it's a skewed relationship. So something as simple as being a Republican or being a Democrat, that in itself is as simple as that. That could skew the relationship between a patient and a therapist because you're just not
Hmm.
seeing your values are different. Therefore, the values that you share is something that you both want to agree on, and that unfortunately is really eh, why we see about 80% of patients fall out of therapy, or fall out of seeking care is because they either don't have a fit with that person or it wasn't the care that they really were looking for.
Hmm. Yeah. How do you believe that we should increase awareness around self-care tips for mental health or other avenues for getting access to or expanding mental health care, such as Rose Health?
Sure. So I think it all comes down from um, really the focusing more on those that have the power to make this change. So, for example, in the school system, being able to speak, speak with those at the upper end, which is more the superintendents, when you look at it, um, and then being able to have them kind of spread that message where this product is needed. Same with in college, having the dean know that this is something that's needed, or even with employees knowing, having their HR or their head of people really know that a product is out there that can help their people with productivity as well as um, helping with absenteeism and presenteeism. So it really starts from the top to be able to provide this solution. So getting the buy-in from those on the top and being able to get the solution out to those that fall below.
Hmm. I know how you mentioned that you were working like incredibly long hours, which contributed to the burnout you experienced and your mental health struggles. So, how do you believe that businesses can foster a better work-life balance to better employees' mental health?
Yeah, so I definitely think that there are certain things that companies can choose to do that would help with mental health. So, for example, I can just give you examples with Rose and the way that we've really dealt with that. So at Rose, we do have a certain things such as unlimited PTO, which is quite common. Now we additionally have where the first Friday of the month is PTO, or mental health Friday or mental health PTO day. So the first Friday of every month, we for everyone's off, and then at some point during the year when I just determine that if I see that the team is highly stressed, then I would do a full shutdown of the
Hmm.
and we would then consult with another team that would handle our patients for that week. Um, and then the Rose employees gets a week to really just kind of rejuvenate so we can get back on and be our best selves when we're trying to help people. Um, the last thing you really want to do is be the company that is burning out folks when you're trying to stop that burnout after all. Um,
Hmm.
and I think with other companies as well, similar tactics where some may not, the archaic companies may not feel that way or would be difficult to do that, but just being able to offer up that mental health day, for example, or having PTO for mental health is significant as well. So being able to at least acknowledge that people do have things going through their lives that require um, that mental health resiliency and that mental health belief um, is really kind of a good step.
Yeah, I know that like I was trying to help out with promoting like a mental health resource day. So if anyone does like have to seek mental health care, if they're a student, it can be excused. So yeah, I definitely understand like the need for that mental health day to try to promote like a better mental health among workers. My final question is, how does Rose Health tailor self-care techniques and other recommendations to the patient? Since I know you mentioned that there's over 1,000 pieces of content. And how is the software able to detect signs of mental illness in order to recommend specific content?
Yeah. So, and that's one thing too that I would recommend changing. So we actually don't like using the word illness because I don't think stress, depression, anxiety is really considered an illness. I think it's more of a
Mhm,
concern. I mean, that's especially given that we deal with mild to moderate. So I wouldn't call it, I think part of breaking the stigma of mental health is by not referring to it as an illness.
mhm,
And
definitely.
and the way that Rose continues to help these patients is through data. So data is really gold when it comes to being able to identify patients who may be at risk. So we ask patients to enter in answers on an assessment, which is called the PHQ-9 and GAD-7. Those are two clinically validated scales within mental health. And through that, we're able to use that data in addition to asking the patient to check in on a daily basis, to enter in their daily mood, daily anxiety, daily sleep on a Likert scale, and be able to journal as well. So that way we have all this information at our uh, uh, all this information that we can use to model out and then predict those who may be at risk within that green, yellow, red risk stratification model we have. And then we've tagged every single piece of content that we have so that we know if a patient is going through some sort of, let's just say it's health issue or a relationship issue, then we know which articles should be sent to that patient. So theoretically, every person on Rose will see a different response on a daily basis because theoretically we are all going through different things in life. So at that point in time, we will all get different content. And then additionally, with our psychiatrists and therapists that we have on our team, they also will specialize. They will also curate a care plan for each individual as well, so that we can ensure that that patient is getting the right care at the right time with the right person.
Yeah. Um, that's all my questions. Thank you so much for your time.